Tajuana Lordeus, and I am a physician assistant. I've been practicing since 2002, and I love my job. I enjoy helping others become more fit and live more abundant lives. Ever since I was a small girl listening to missionary stories at church, I knew that I wanted to help others around the world. In high school, I was a candy striper. They don't do that much these days, but I wore a red and white striped uniform, and I went to the hospital on the bus for 3 hours a week, and I would do various tasks. Magazines, newspapers, and flowers to patients that were hospitalized. I also would sometimes work in the cafe of the hospital or in the gift shop. And at that early age, it let me get a bird's eye view into how the various illnesses affect the family as a whole. In 1996, I went to Kenya for 2 months to serve as sort of a medical missionary. This was about my sophomore year of college, and I spent 2 months there, and we would go as a team into the community to talk about HIV/AIDS prevention and the importance of having mothers get their babies vaccinated. It was a very fulfilling experience because we kind of roughed it, and we got to meet the local community and make new friendships. I have worked in various settings since 2002. I've done work in urgent cares, and that was rewarding because I was able to work with military families and people of various nationalities. I've also worked in family practice for many years, and that has its own set of unique challenges because I will often encounter patients who might have barriers such as not speaking English, so they have a language barrier. I've worked in emergency medicine, and I currently work in pain management. So I see people of all different walks of life managing their pain syndromes. Being a healthcare provider is personal to me because both of my parents have diabetes. Both sets of grandparents are diabetic. My younger brother has had diabetes for the last couple of years. I've had 2 grandparents die of the results of long-standing uncontrolled diabetes, of kidney failure. So I even had gestational diabetes when I was pregnant with my 4-year-old son. And so it's been kind of a constant struggle to work with my family and my own health concerns, to stay fit, to stay well, and to try and eat healthy. As a mother, a wife, and a coworker, I work full-time. It is very difficult to live a life of fitness and to live healthy. You have to carve out time sometimes to do meal planning. You have to plan your trips to the grocery store to make sure you choose healthy foods. You have to budget for healthy eating. And that's something some people overlook, is the cost of healthy foods and menu planning. And in addition to that, if you're a busy woman, you have to carve out sufficient time to prepare nutritious meals for your family. So I totally understand how many people get frustrated with trying to live healthier lives. And that's sort of my passion, is to try and help people not give up totally, but maybe make small changes so that they can become healthier. The acronym stands for Health, Education, and Lifestyle Programs. And I was motivated to start the business for numerous reasons, but mostly because I have 13 years of experience as a physician assistant working in primary care, urgent care, emergency medicine, and other various fields where I've had to manage diabetes, hypertension, female gynecological problems, so many other diseases. And the wealth of experience let me know that it was time to launch a business that I could disseminate important health information to my local community. It would be wonderful to have this information accessible online, and also to make myself available to teach classes and to give seminars and lectures to further educate others. I often find patients feeling intimidated when they talk to medical professionals about their diseases and small things they can do at home to manage their illnesses. but they feel comfortable talking to me one-on-one. And so, I know that I'm a good candidate that is approachable and able to educate others with the knowledge I've gained from my education and work experience. As a business owner for HELP, which stands for Health, Education, and Lifestyle Programs, some of the services that I'm able to offer my clients are CPR certification. I'm certified by the American Red Cross to teach CPR and AED training, as well as first aid to non-clinical people and to medical professionals. I'm also available to give lectures on various topics, such as the health awareness topics that we have monthly. Some of those include prostate cancer awareness, breast cancer awareness, ovarian cancer awareness, childhood obesity, nutrition, fitness, any topic, health topic that needs education. I'm able to provide those services. Well, around November of 2014, I attended a funeral at a church in a remote location in North Carolina. And while I was sitting in the pew paying attention to the services, a lady became faint and sweaty. And the staff at the church was aware that she had a diabetes history, but they didn't know what to do with the situation at hand. As a visitor in the church and a certified physician assistant, I went up to the staff of the church that were gathering around the lady to find out more information about the situation. And I recommended that they give her a cup of juice or a piece of candy, knowing that she's diabetic. What most people don't realize in a situation such as that, it's easier to bring a low blood sugar higher and help the person not have so many symptoms as it is to bring a high blood sugar down. So I was trying to get them to see where they could make, some small modifications to help improve the lady's condition. And I wasn't getting very far, because no one had a health kit available, no one had extensive health education about some of the diseases or illnesses you might find in a large group setting. And so I had an epiphany at that moment as I was waiting for the ambulance personnel to come and see about the lady's health, that it would be wonderful for me to launch a business in which I can go to different churches, civic groups, or community groups, or even teach individuals small things about their health. Some of these simple things that I keep referring to are mostly preventative things, but once you've been diagnosed with a disease, it's these types of things that help the disease from progressing. And I like to live by exercising regularly, getting fresh air on a daily basis, drinking plenty of water throughout the day, trying to get proper rest, and of course your diet is a big part of it, eating a plant-based diet rich in fruits and vegetables, and finally managing stress. In today's society, we're always on the go. We have so many distractions, and stress plays a big role in disease management. And these are things that don't cost a penny. You can do a lot of these things at home on your own, but sometimes our lives are so busy and so difficult that it's hard for us to see the track that we should follow for healthiness. There are so many little changes that you can do if you have a health kit at church or in a large community group that makes a big difference. And another important thing is we talk about the AED machine. One of the ways to improve the success rate of someone having a heart attack or a cardiac emergency is to have an AED machine on site. Some churches may have the machine, but they're not equipped to use it. They may be intimidated to open it up when they know the person may be having a cardiac emergency. So it's some of these things that are kind of intimidating at first, but I know that with proper training, we can improve the health overall of so many in our local community. My hope is that I will be able to disseminate information to help people not feel overwhelmed or intimidated to live healthier, more abundant lives. There are so many areas of health and fitness and wellness that we could cover with small seminars or lectures, and it's something that I enjoy doing. It's a passion of mine. I would prefer to spend my free time in service to others, because volunteering is a big part of who I am, but I would like my services to be utilized by the local community. Most recently, I did a lecture on polycystic ovarian syndrome. And it was requested that I do a lecture on this topic because one of the church members has this syndrome. And the syndrome can sometimes cause women to have difficulty losing weight, have fertility problems, have facial hair or body hair similar to a male's growth of hair. And it's an embarrassing syndrome for a woman to have because people out of ignorance will come up to her and ask her why haven't she and her husband given birth to any children yet? Why can't she lose weight? She has such a pretty face. Why can't she lose weight? And it's something that has plagued her for many years, and she was very frustrated, and she felt that the church members needed education about this syndrome. So I did give a talk one Saturday evening. It was about an hour and a half long, and I was able to get the information out about polycystic ovarian syndrome. I was also able to have a Q&A session, and even the young girls in the audience were intrigued with some of the slides and pictures that was shown for the lecture. It was a very rewarding experience because I had members come up to me afterwards saying, I never knew about this syndrome. And some of the members apologized to the lady who was upset about how she was received by the congregation with having this syndrome. One of the pearls I gained from giving that lecture is there are a lot of unknown diseases. Actually, they're called invisible diseases, I think, because you walk around with these diseases and you're sitting next to people and on the outside they look perfectly healthy, but you never know if they suffer from mental illness, if they have hypertension, if they, for instance, have polycystic ovarian syndrome, sometimes thyroid disease. So many different diseases that we don't often talk about in various settings can be manifested in those you work with, those you live with, your family members. And it would be good to have education in case, their disease deteriorates. You'll know more information about it and how you can best help them. But also for prevention. That's number one, is how can you prevent some of these diseases that are preventable. I recently taught CPR to my husband, my daughter, and a lady I met at Whole Foods grocery store. And it was a very, very successful class. I was so proud of my 12-year-old daughter learning how to do compressions and rescue breaths. And what was also amazing is when my 4-year-old son came into the room and he wanted to mimic some of the motions of CPR. So, of course, American Red Cross advises that you certify clients age 11 and up. But just to see the young people knowing how to respond to an emergency. Our young people are so mobile these days. Teenagers, they can use public transportation and go to the mall, go to the movies. And what if one of their friends is choking on a piece of candy? They should know how to do abdominal thrusts and back blows to help them dislodge the object. Just various small things that CPR and first aid training can teach various ages is very beneficial.